We've all heard stories about challenges consumers face when shopping for insurance coverage in the healthcare exchanges. To discover what consumers are experiencing firsthand, we went on the healthcare exchange and searched for basic information about health plans. The Partnership to Fight Chronic Disease, a coalition representing more than 100 different healthcare stakeholders, is focused on raising awareness of the human and economic toll of chronic disease and advocating for health reforms that lessen that burden. For all consumers, but particularly for people with chronic diseases, having good healthcare coverage is critically important. There are many questions consumers want to answer. Two basic ones are, can I keep my doctors? And are my medicines covered? To find out what a consumer has to do to find out if her medicines are covered by a specific health plan, we search for plans. On the California Healthcare Exchange, we previewed health plans by typing in zip code 95814, entering an income of $51,000 a year, said we were a one-person household, and age 45. We chose to use an income level that did not qualify for subsidies to see the full costs. The next screen gave us the option to select our utilization of healthcare services to help project costs under each plan, a very handy tool for consumers. Our search yielded 23 plans in total. We chose to look at silver plans since silver plans have been the most popular with consumers. There are 5 silver plans available. Though there is a section for drugs under each plan, there is not a link to a list of covered medicines. That meant we'd need to look further at each plan individually. For the silver plan with the least expensive premium, we clicked on the plan for more details. Trying the plan brochure link led to a confusing list of different links, so we went back and tried the summary of benefits document. To view the document, we had to select one of 2 options under Actions. Looking at that document, we found a link to information about medicines on page 3. That link led to a web page that described a 5-step process for finding the formulary. The first step was to figure out which link to 4 different health plans to follow. We could eliminate Georgia and Empire since we're in California and didn't see any mention of Empire in the name of the health plan, but that still left 2 options. We tried this one, assuming the CA stood for California. We then followed the steps, selecting Customer Support and Forms Library. We finally found the drug lists. In fact, we found 23 different links to files about covered medicines. There's no search option for consumers, and the link on the side is just for consumers already insured. Consumers just have the option of downloading the lists and reading through them to find what medicines are covered. Next, we tried the same thing for the silver plan with the second least expensive premium. Clicking on that plan for more details, we discovered there is not a link to anything except the provider directory. So we tried that. The link led to this home page. Through trial and error, we discovered that 2 of the 4 tabs at the top of the page do eventually lead to a list of covered medicines, and 2 are dead ends. For example, choosing health and wellness, we followed links relating to pharmacy, and 4 different web pages later, we found a searchable list of covered drugs for this plan. It is searchable, but the therapeutic categories list of medicines are not consumer-friendly. How many cancer patients, for example, would know to look under anti-neoplastics to see if their cancer medicines are covered? For consumers, finding out if their medicines are covered by a health plan is extremely challenging. we had to open that document by clicking on an icon under Actions. Looking at the summary of benefits, we found a link to information about medicines on page 3. That link led to a web page that described a 5-step process for finding the formulary, or list of covered medicines. The first step was to figure out which link to 4 different health plans to follow. We could eliminate Blue Cross Blue Shield of Georgia and Empire, since we're in California and didn't see any mention of Empire in the name of the health plan, but that still left 2. We tried this one, assuming the CA stood for California. We then followed the steps listed, first selecting Customer Support, and then by looking under Forms Library. We finally found the drug list. In fact, we found 23 different links to files about covered medicines. There is no search option for consumers, and the link on the side is just for people already insured. Consumers have to open a list and read through it to find what medicines are covered.